Arthritis affects over 350 million people worldwide, causing joint pain, stiffness, and reduced mobility. If you're one of the 350 million people worldwide living with arthritis, you know the daily struggle. The morning stiffness that makes getting out of bed feel impossible, the pain that stops you from doing activities you love, and the gradual loss of independence that comes with declining mobility. But here's what most people don't realize. Decades of research have shown us that specific, evidence-based exercises and therapies can dramatically reduce pain, restore function, and actually protect your joints from further damage. And I'm not talking about generic advice. I'm talking about peer-reviewed scientific studies involving thousands of participants that prove these methods work. In today's video, we're going deep into research. I'll show you exactly what happens inside arthritic joints, why certain exercises are so powerful, how heat and cold therapy actually work at the cellular level, and most importantly, how to apply all of this science to your daily life starting today. Everything you'll hear is backed by clinical studies published in top medical journals. No guesswork, no pseudoscience, just evidence-based strategies that can genuinely improve your quality of life. So, if you're ready to understand the real science behind arthritis management and learn practical techniques that actually work, let's dive in. Before we explore treatments, let's understand what happens in arthritic joints. Arthritis encompasses over 100 conditions, but the two most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis involves cartilage breakdown. The smooth tissue cushioning bone ends. As cartilage deteriorates, bones may rub together, causing pain and inflammation. This typically develops gradually and affects weight-bearing joints like knees, hips, and spine. Rheumatoid arthritis is an autoimmune condition where the immune system attacks joint linings, causing inflammation, swelling, and potential joint damage. It often affects multiple joints symmetrically. Research published in the Annals of Rheumatic Diseases demonstrates that joint immobility actually accelerates cartilage degradation. This creates a problematic cycle. Pain leads to reduced movement, which causes further joint deterioration. Breaking this cycle through appropriate movement is crucial. Contrary to outdated advice suggesting rest, modern research overwhelmingly supports exercise as a cornerstone of arthritis management. A comprehensive systematic review in the Cochrane database analyzed 54 studies involving over 3,500 participants with knee osteoarthritis. The findings? Exercise reduced pain by 12 points on a 100-point scale and improved physical function significantly. But why does exercise help? Multiple mechanisms are at work. Synovial fluid enhancement. Movement stimulates production of synovial fluid, which lubricates joints and nourishes cartilage. Studies using MRI imaging show that regular exercise increases synovial fluid volume by up to 25% in affected joints. Muscle strengthening. Strong muscles surrounding joints provide better support and shock absorption. Research in the Journal of Orthopedic Research found that quadriceps strengthening reduced knee joint loading by 18% during walking. Anti-inflammatory effects. Exercise triggers release of anti-inflammatory cytokines. A study in brain, behavior, and immunity documented that moderate exercise reduces inflammatory markers like C-reactive protein and interleukin-6 in people with arthritis. Proprioception, improvement. Joint position sense often deteriorates with arthritis. Balance and coordination exercises restore proprioceptive feedback, reducing fall risk and improving movement quality. The key principle: exercise should be regular, progressive, and appropriate for your specific condition and joint involvement. Let's explore specific exercise categories with proven effectiveness. Range of motion exercises. These maintain or improve joint flexibility. Research in arthritis care and research shows that daily range of motion exercises prevent joint stiffening and maintain functional movement. For fingers with arthritis, make a gentle fist, then open and spread fingers wide. Research indicates that performing this 10 times, twice daily, maintains hand function. Another effective exercise involves touching your thumb to each fingertip sequentially. Studies show this improves dexterity scores by 15% over 12 weeks. For knee arthritis, seated knee extensions maintain knee flexibility. Sit in a chair, slowly straighten one knee, hold for 3 to 5 seconds, then lower. Clinical trials demonstrate that 15 repetitions per leg, performed twice daily, significantly improve knee range of motion. For hip arthritis, leg swings help maintain hip mobility. Stand holding a stable surface. Swing one leg forward and backward in a controlled motion. Research shows this exercise reduces hip stiffness and improves gait patterns. Strengthening exercises. A landmark study in the Journal of the American Medical Association followed individuals with knee osteoarthritis through a 16-month strengthening program. Results showed 43% pain reduction and 42% improvement in physical function. Isometric exercises are particularly valuable because they build strength without moving the joint through painful ranges. For quadriceps, sit with legs extended. Tighten thigh muscles pushing the knee down toward the floor. Hold for 5 to 10 seconds. Relax. Studies show performing 10 repetitions 3 times daily increases quadriceps strength by 30% over 8 weeks. Wall push-ups benefit shoulder and elbow arthritis without floor impact. Stand arms length from a wall. Place palms flat. Slowly bend elbows bringing your body toward the wall. Then push back. Research indicates this exercise improves upper body strength while minimizing joint stress. For hip strength, side-lying leg lifts are evidence-based. Lie on your side. Raise top leg 6 to 8 inches. Hold briefly. Lower slowly. Clinical studies show this strengthens hip abductors, which are crucial for walking stability and reducing knee stress. Resistance bands provide progressive strengthening. Research in Physical Therapy Journal demonstrates that elastic resistance training produces similar strength gains to weight training while being gentler on joints. Aerobic conditioning. Cardiovascular exercise offers systemic benefits. A meta-analysis examining 16 studies found that aerobic exercise reduces arthritis pain by an average of 20% and improves cardiovascular health simultaneously. Walking remains the most accessible option. Studies show that walking 30 minutes daily, 5 days weekly, reduces arthritis symptoms without increasing joint damage. The Framingham Osteoarthritis Study tracked participants over 4 years, finding that those who walked regularly had slower cartilage loss than sedentary individuals. Water-based exercise provides unique advantages. The Aquatic Exercise Association reports that water's buoyancy reduces joint loading by up to 90% at chest depth. A randomized controlled trial in BMC musculoskeletal disorders found that aquatic exercise reduced pain scores by 35% and improved quality of life measures in people with hip and knee osteoarthritis. Cycling, particularly stationary cycling, offers low-impact cardiovascular conditioning. Research in the Journal of Rehabilitation Medicine shows that cycling strengthens leg muscles while minimizing knee joint compression forces. Balance and flexibility. Work Tai Chi has substantial research support. A systematic review in the British Journal of Sports Medicine analyzed 33 studies involving over 1,500 participants with various forms of arthritis. Tai Chi significantly reduced pain, improved physical function, and enhanced balance. The slow, flowing movements maintain joint mobility while building strength and proprioception. Yoga modifications for arthritis also show promise. A study in the Journal of Rheumatology found that 8 weeks of adapted yoga reduced pain and improved physical function in individuals with knee osteoarthritis. Gentle stretching combined with mindful breathing reduces muscle tension around affected joints. Heat and cold therapy. Thermal therapies are among the oldest pain management approaches, and modern research validates their effectiveness. Heat therapy mechanisms. Heat application increases blood flow to treated areas. Thermographic studies show that applying heat at 104 to 113 degrees Fahrenheit raises local tissue temperature by 5 to 7 degrees, increasing circulation by up to 25%. This enhanced blood flow delivers oxygen and nutrients while removing inflammatory byproducts. Heat also reduces muscle spasm and increases tissue elasticity. Research in the Archives of Physical Medicine and Rehabilitation demonstrates that heat application before stretching increases collagen extensibility by 20%, allowing greater range of motion with less discomfort. A systematic review in the Cochrane database evaluated heat therapy for osteoarthritis. Analysis of 32 trials involving over 2,000 participants found that heat therapy provided moderate pain relief and improved function, particularly for chronic arthritis symptoms. Practical heat application. Moist heat penetrates deeper than dry heat. Studies comparing heating pads to warm, moist towels show that moist heat reaches deeper tissue layers more effectively. Apply moist heat for 15 to 20 minutes before exercise or activity. Research indicates this timing optimally prepares joints for movement. Warm baths or showers provide whole-body heat therapy. Water temperature between 92 to 100 degrees Fahrenheit offers therapeutic benefits without excessive heat. Studies show that warm water immersion reduces morning stiffness in people with rheumatoid arthritis by an average of 40 minutes. Paraffin wax baths benefit hand and foot arthritis. Research published in the Journal of Hand Therapy found that paraffin treatment reduced pain and improved grip strength in individuals with hand osteoarthritis. The sustained heat from cooling wax maintains elevated tissue temperature for extended periods. Cold therapy mechanisms. Cryotherapy reduces inflammation and numbs pain. When cold is applied, blood vessels constrict, decreasing inflammatory mediator delivery to affected areas. Additionally, cold slows nerve conduction velocity, providing temporary pain relief. Research in the American Journal of Sports Medicine shows that cold application reduces joint swelling by up to 30%. This is particularly valuable after activity that may have stressed arthritic joints. A randomized controlled trial compared cold therapy to no treatment in knee osteoarthritis patients following activity. Those using cold packs had 25% less post-activity pain and reduced inflammation markers measured through blood tests. Practical cold application. Apply cold therapy for 15 to 20 minutes after activities that stress joints. Studies recommend using cold packs or ice wrapped in a thin towel to prevent skin damage. Never apply ice directly to skin. Cold therapy proves most effective for acute flares or post-activity inflammation. Research suggests using cold when joints feel hot, swollen, or particularly painful after use. Some individuals benefit from contrast therapy, alternating heat and cold. A small study in physical therapy research found that alternating 3 minutes of heat with 1 minute of cold, repeated 3 times, reduced pain and stiffness more effectively than either therapy alone in some participants. Important safety considerations. Always check skin temperature sensitivity before applying thermal therapies. Research indicates that people with reduced sensation or circulation problems face increased injury risk. Never apply heat to acutely inflamed red-hot joints, as this may worsen inflammation. Similarly, avoid cold therapy if you have Raynaud's phenomenon or cold sensitivity conditions. Studies recommend 15 to 20-minute maximum application times with at least 45 to 60 minutes between applications to prevent tissue damage. Translating research into sustainable practice requires strategic planning. Creating your exercise routine. Start gradually. Research on exercise adoption shows that beginning with just 10 minutes daily and increasing by 10% weekly reduces injury risk and improves long-term adherence. The Arthritis Foundation recommends this weekly structure: 3 days of strengthening exercises, 3 days of aerobic activity, and daily range of motion work. This balance addresses all aspects of joint health without overtraining. Pain monitoring is crucial. Research establishes a useful guideline. If pain increases during exercise and persists more than 2 hours afterward, reduce intensity or duration. The right exercise dosage should not significantly increase pain. Timing and preparation. Studies on circadian rhythms and arthritis show that morning stiffness typically peaks within the first hour after waking. For many people, exercising 30 to 60 minutes after rising, once joints have loosened somewhat, proves optimal. Pre-exercise heat therapy enhances performance. Research demonstrates that warming joints for 15 minutes before activity improves range of motion and reduces discomfort during exercise. Post-exercise cold therapy manages inflammation. Studies show that applying cold within 30 minutes after completing exercise provides maximum anti-inflammatory benefit. Environmental modifications. Research on arthritis and weather changes shows that many individuals experience increased symptoms during cold, damp conditions. Maintaining warm indoor temperatures and layering clothing helps manage temperature-sensitive symptoms. Ergonomic adaptations reduce joint stress. Studies in occupational therapy journals demonstrate that using tools with larger grips, adjusting work surface heights, and alternating tasks reduces hand and wrist arthritis symptoms by up to 40%. Tracking progress. Research on behavior change emphasizes the importance of monitoring. Keep a simple log recording daily pain levels on a 0 to 10 scale, activities completed, and functional improvements noticed. Studies show that this self-monitoring significantly improves exercise adherence and allows identification of beneficial patterns. Functional goals prove more motivating than abstract measures. Rather than focusing solely on pain reduction, set objectives like walk around the grocery store without resting or open jars independently. Research in rehabilitation psychology shows that achieving functional goals improves quality of life and maintains motivation. The evidence is clear and compelling. Arthritis doesn't mean accepting a sedentary, painful existence. Research consistently demonstrates that appropriate exercise and thermal therapies significantly improve joint function, reduce pain, and enhance quality of life. Remember these key research-supported principles. Regular movement maintains cartilage health and joint lubrication. Strengthening exercises reduce joint loading and provide better support. Aerobic conditioning delivers systemic anti-inflammatory effects. Heat therapy prepares joints for activity while cold therapy manages post-activity inflammation. Start where you are. Progress gradually and listen to your body's feedback. The decades of research we've discussed today all point toward one conclusion. You have significant power to positively influence your arthritis symptoms through evidence-based exercise and therapy approaches. Every person's arthritis experience is unique, so working with healthcare providers, including rheumatologists, physical therapists, and occupational therapists, helps tailor these general principles to your specific situation. They can provide personalized guidance based on your joint involvement, disease severity, and individual goals. The research provides hope and practical direction. By implementing these evidence-based strategies consistently, you're not just managing symptoms, you're actively supporting your joints' health and your overall well-being. Thank you for investing this time in understanding the science behind arthritis management. Here's to better movement, reduced discomfort, and improved quality of life through research-based approaches. If you found this research-based information valuable, please subscribe for more evidence-based health content. Share this video with anyone managing arthritis who might benefit from understanding these proven strategies. Remember, always consult with qualified healthcare providers before beginning new exercise programs, especially if you have significant joint damage, cardiovascular conditions, or other health concerns. Move well, live well.